Good morning, ladies. It's Dr. Lourie, and I'm here with one of my favorite people and dear friends and colleagues, Dr. Keira Barr, who's like, she was trained as a dermatologist, which you would think, why is she here? What is dermatology have to do with integrative care? But she has taken it way beyond that and is going to share her vision and her expertise with you. So happy you're here, and thank you for being here, Keira.
Thank you so much. It's my pleasure. I'm excited. Let's
Let's
chat.
go skinny dipping.
It's so funny. I had this wallpaper put up. It's nude figurines, and it threw the wallpaper installation gal for a loop. She's like, "I've never put up nudie wallpaper before." I'm like, "Hey, let me be the first one."
I can't really tell that.
Yeah, very subtle. I wanted to be kind of PG when I'm on camera, but yeah, there's
right.
naked bodies out there.
Okay, well, that's great. Let's talk about being naked and being naked in your skin and how we all feel about our bodies thanks to the male-dominated messaging of American advertising. Yuck. So, what do you have to say about your skin? I love how you use it as an analogy for our health.
I think, on so many levels, our skin, number one, is, I'm biased, but I think it's the most amazing organ because it is our ultimate barrier between us and the outside world. And there's so many ways that we can look at it from that perspective, right? It is a source of pure pleasure from touch. And even though it also is a source where we can feel pain, those are messages. And so your skin is a messenger of what's happening beneath the surface. I always say that, your skin can be a window and reflection of what's happening in your life. It's also a window into your nervous system. And the brain and the skin are derived from the same embryologic layer of tissue, which means that they're talking to each other all the time. When we talk about our skin, it's like, oh, they're getting under my skin, makes my skin crawl. When I'm nervous, I flush or I get sweaty palms. I mean, that is an indication, right? That communication is all the time, and we can leverage that. It's not something we need to cover up, like society tells us we should cover it up, camouflage it. No. Like, we can use this and leverage it to help us heal, help us thrive.
And how do you do that?
Yeah. So I think first and foremost, it is being open to the possibility that when you look in the mirror and you see those fine lines and wrinkles, or you see that your skin is breaking out, it's a little red and irritated, that nothing has gone wrong. In fact, so much has gone right. Your body is functioning just as it thinks it needs to in this moment to help you survive. Your body is wired for survival, and your skin is an indication of that. So that, talking about stress response, and cancer. There is a huge connection between stress and trauma and cancer, right?
100%.
What? 100%.
Yeah.
And I think, we pathologize this concept of stress, like stress is bad somehow, but it's not. Stress in and of itself is a normal adaptive response, right? And if anyone is familiar with Dr. Dan Siegel, who's a psychiatrist, he has this model of like a window of tolerance. So there's, the bottom, the top, and ideally when we are riding the waves of our stress, experiences, we're staying within that window. But the challenge in our current world where things may feel upside down is that many of us cross a tipping point. We go beyond our window. Things overwhelm our nervous system. And that's when we can feel anxious and overwhelmed. So there's too much, too fast, too soon, or there's too little support for too long. And so our nervous system is completely overwhelmed and dysregulated. It's in those moments that our body goes into survival mode. And we know in the cancer world, that means that a lot of hormones are being released, your primary stress hormones, cortisol and adrenaline and noradrenaline, and lots of inflammation. And that has been shown to alter what happens to the tumor the environment in which our cells, that our cancer cells can function. And it leads to cancer formation and cancer progression. and treatment things, and that shows up on your skin as well. Skin cancer being the most prevalent cancer in the United States and Canada, right?
Huh.
So there,
And is that
yeah.
because of sun exposure or something else, do you think?
So I think it's multi-layered. So everyone wants to blame sun exposure. UV radiation is an environmental stressor, definitely contributes. But there's also this concept of oxidative stress, right? How is our
Right.
body responding to that environmental stressors? Are we resilient enough on the inside to be able to combat the damage that's being done? That's why sleeping, beauty sleep is real. Like we have to fortify our skin's resilience from the inside out. So nutrition, moving your body in a way that feels good, sleeping, but also helping to regulate our nervous system, because there is a correlation. A lot of research has been done. In fact, I'm actually presenting all about this at the American Psychocutaneous Association next week about
Wow.
stress,
Great.
yeah, stress, trauma, and skin cancer.
Oh, that's a great topic. I love that topic.
Yeah, because it's not just you. I mean, right? It's not just the the
It's not
diagnosis.
the diagnosis. The diagnosis is the message that your body is giving everyone. Hi, we have a problem here.
Totally, totally. And then the aftermath of that, that can be stressful too.
Oh,
Navigating
the
treatment.
aftermath is the worst. It's almost, yeah. I mean, I don't know. Women say to me, I don't know which is worse, the diagnosis, the treatment, or the recovery, or the long-term hormone blocking medication. They can't choose, which is the most difficult. And it's a really valid upset moment, which is more difficult. But it's your job and my job to help women be able to turn the volume down on the difficulty and get a hold of what needs to happen so they can have a nice quality life and be engaged and be vibrant. And how do we do that?
Yeah. So the beginning, I think, especially when you have a cancer diagnosis and you may feel like your body has kind of sabotaged you, or your body may not feel like a safe place to be,
Mhm.
it's, learning how to reconnect with that body, right? And finding comfort in ourselves. And that means slowing things down a little bit, listening to the signals and signs. Some of the treatment can cause your skin to erupt and be inflamed, or down the road, there are times when your skin can be the indicator that, you know, there's cancer can present on the skin as well in breast
Mhm.
cancer. So it really begins by being open to the possibility that your body can be a source of wisdom and comfort. And we do that slowly and gently through practices. Um, and the one that I love the most is just attuning to, our breath, slowing things down. Because a lot of times it can feel very triggering, right? And there's too much noise. Um, so we just offer ourselves an invitation just to slow things down a little bit.
I always start my weekly live group coaching with a meditation. And I ring my little bell, my magic bell, and I go, okay, put your hand over your heart, take a deep breath in, slow your breath. And it's just amazing. You can just feel the energy change. It takes 3 seconds.
Totally.
And, for the women who are listening to this while we're live and afterwards, if you're having a difficult moment, that is a very powerful thing that you can do. Is it going to magically solve all your problems? No. But can it make you feel like m- more like you can get a grip on something even by 5, 10, 25%? That makes a big difference. Yes, right?
Absolutely.
Yeah.
And I love that so much. I think that sense of touch, right? Our skin has so many receptors, and that compassionate touch and the release of that love hormone, oxytocin, making that connection with yourself is can feel a little challenging sometimes, but it's as simple as just putting a hand to your chest or a hand to your belly. And even if, you feel kind of overwhelmed, that can be there. right? The anxiety, the tension, the pain can be there. And I always love to ask the question, yes, and what else? What else is here? Is there any part of you that feels a little ease, a little softer? You know, it could be the tip of your pinky, but it's there. And can you breathe into that? Can you allow yourself to lean into that? Right? Where our energy flows, where our attention goes. So can we shift just a little bit, dip into that? The parts of us that may not be tense, and or just even asking the question, what do you need right now in this
Mhm.
moment? Right? If you feel tension, do you need to just lay a hand? One of my favorite practices is, rubbing our hands together, and not just rubbing just for the sake of it, but even feeling the temperature of your hands, the texture.
When you do that, it gets warmer in between,
It
right?
does warmer, and then just palpating, right? It's like I've got a little tension in my shoulder, so I'll put a hand here. A really nice one when you're feeling very unmoored, is a hand on the forehead and a hand on the back of the head, just creating
Mhm.
a bit of stabilization. And then just, inviting where else needs attention, right? This skin of yours loves to be touched and tended to, and you can just move your hands to the various places on your body and just give it a little bit of love, the parts of you that are saying hello. Oftentimes when we feel aches and pains and our body's saying hello, we're like, shut up, don't talk, I don't want to hear it, right? And then we brace more.
Do the
And
shut up approach. It doesn't work. It makes things much worse,
oh my gosh,
right?
that volume turns up so loud, doesn't it?
Yeah. And, that's what our society does. Somehow we're ingrained to, like, we have a feminine intuitive response, and then that little negative voice goes, oh, forget that, or shut up, or that's ridiculous. We diminish our intuition. And I think one of the aspects of recovering your health and restoring your life to a really vibrant life, the kind that you've always dreamed of, where you can go skinny dipping no matter what your size, is all about getting in touch with that intuitive aspect that we tend to put on the back burner too often, right?
Absolutely, absolutely. And this idea of skinny dipping, yes, it's important to
It's a metaphor, right? It's not,
totally. That being said, skin cancer is the most prevalent cancer in the United States and Canada. So getting naked physically, that's how this all started, is really important. We need to be familiar with the skin that we're in, what is on it. I always encourage everyone on the date of their birthday to party on their birthday suit, to check for any uninvited guests, really looking for anything on your skin that's new, that stands out from your crowd, any spots that are growing, changing, itching, bleeding. Those are messages from your body. Doesn't always mean that something is terribly wrong, but it's an invitation to look into it further, to investigate, especially when you've had cancer treatment, when you've had a diagnosis of breast cancer. Metastasis can occur on the skin. There are many instances, not where when I was in clinical practice, that we were the first ones to diagnose metastatic disease.
inflammatory breast cancer. Yeah.
So getting naked literally is important. And ladies, get a hand mirror. Skin in your perineum, in your vaginal area, is skin like anywhere else. Get familiar with your intimate bits, right? That's really important. But that beyond that, the metaphor of stripping away the layers, exfoliating the people, the places, the things in your visual environment, on your social media, on your calendar that are just weighing you down and dulling your complexion. That is part of this as well, right? The habits, the thoughts, the behaviors. And it's hard to do that on our own because we're so ingrained. Our patterns are so ingrained. We've been conditioned to believe so many things by our society. I mean, talk about anti-aging. That's awful. We've somehow been convinced that we shouldn't be aging. Hello, especially if you've had a cancer diagnosis. Every day is a celebration. afterwards, like, that you get to age one more day. Like, this is amazing. Why are we saying anti anything about that? It's
Well, it's like
ridiculous.
anti-breast cancer diet. I don't do the anti anything. It's not anti, it's pro. And
Yes.
I don't agree with that message, the anti-breast cancer, the anti this. It's a war. We're attacking. We're conquering. We need a more feminine approach and an attitude, because breast cancer is a disease of the feminine. It's not a disease of the masculine with these words: war, attacking, conquering. Not healthy. And it's the same with aging. It's like, okay, we're all going to get old. We want to keep ourselves vibrant and healthy, but the anti-aging and the anti-breast cancer is sort of like in the same bucket, right? It's the words matter, and because they influence how you approach your thoughts, right?
Ab- Absolutely. Absolutely. I'm so glad that you mentioned that, because that is what bothers me too. It's like fighting, working against, and the way that we thrive is working with. Your skin is a window to your nervous system. Cancer is part and parcel. It is an indication that things are out of balance, that your body is doing exactly what it thinks it needs to be doing in this moment, which is mounting inflammation and, not allowing those abnormal cells to die off because somehow things are out of balance, right? So if we work with our physiology, we work with our nervous system and help bring ourselves back into balance through
Mhm.
that we eat, through, nurturing ourselves with things that bring us joy and pure pleasure. That is how we thrive. Not this fighting. It isn't a war. It's like, how can we be with ourselves more to find more peace, more ease, and more calm? And as you said, a lot of that has to do with how we language this, our perspective on this. Yeah.
100%. 100%. Um, I have women who come into my group and live coaching, and the first week I ask women to talk about their attitude towards their chronic disease, which is breast cancer. Breast cancer is a chronic disease, just like an autoimmune problem, just like colitis. It's a chronic disease. I'm trying to take the fear, oh my God, I have breast cancer. It's a chronic disease. We need to learn how to manage it, right? And I'd say 80%, well, I'm into attacking this. I'm going to conquer this. And then I do this whole let's revise the thoughts about this. And women are like, their faces, you can see how the heaviness goes away out of their energy field. So once again, ladies, listen to your words. I think what Dr. Barr is saying is so important. We're always so much on the same path. It's really wonderful to have you here. And so with their skin cancer, let's go back to your area of expertise, potential. I like this idea of getting naked and looking at your body. And sometimes it's hard to look at your back. You can get your spouse to do it, but you can also make an appointment with a dermatologist and say, I want to have a whole body scan. And usually you need to do that months in advance. So it's not a bad idea to do it 6 months in advance. And if you've had breast cancer, you can even go twice a year, because there can be more likelihood of something showing up. And you want to make sure that the dermatologist knows that you've had breast cancer, so they can do a really very thorough evaluation for you.
Yeah, that's such good advice, because especially if you are on a cancer treatment
Tamoxifen,
regimen,
aromatase
right?
inhibitors,
Your immune, yeah,
immunotherapy, major side effects, right?
major side effects, and your immune system may be suppressed, which means that your window of tolerance for other environmental stressors or other stressors in your life, your body may not have as much reserve. Things may start showing up or popping out. And so it is helpful to have another set of eyes. I always engage, like, listen, partying your birthday suit could be fun if you have someone to party with, and you can make it date night with your partner. You can check each other. It's, and have fun with it. This is we have to be playful and talking about how we regulate these our nervous system. And part of that is tapping into our resources. And resourcing is anything that helps you feel nurtured, supported, safe. And much of that is looking to our internal resources, humor, playfulness, and then, movement or dancing or journaling or art. Not everyone's family of origin is a source of support, right? That's just the
Really,
reality of it. So we can look to our family of choice, to our community, to our spirituality. All of these things help you feel a little bit more calm, a little more joyful. That helps your nervous system settle back down, brings you back into that window of tolerance where you can just more easily ride the waves. Listen, stress is going to happen. This is life. This is reality. But the goal is to be able to just ride the waves. You get a little bit nervous, a little bit edgy, and then you're able to come back down, and your skin will respond to that. It'll respond to that.
I love that. The skin responds to the health of your nervous system.
100%. So again, the brain and the skin are derived from that same embryologic layer of tissue. They're communicating all the time. When we think about the stress response, we always think it's a top-down issue where the hypothalamic pituitary adrenal axis, lots of words, releases hormones, cortisol and inflammation. But many people may not appreciate your skin has the exact same mechanism. Your skin has its very own HPA axis. So your skin is both a target and a source of this stress response and inflammation. So your skin absolutely responds when you're stressed. If you've ever had like a big event and you're really nervous and you break out in a cold sore or your acne breaks out, the reason is cortisol, that primary stress hormone that's released to get our bodies ready to deal with whatever the stress is. So, right, a normal response. But that cortisol directly stimulates those oil glands, pumping out sebum, which is one of the primary contributors to acne. And there's also inflammation. So, one of the biggest reasons, and there's also a shift in our immune system. Stress can, over the long term, suppress our immune system. And that's where you might notice those cold sores popping out, because it's right that the herpes virus is living in our nerve
Or
roots.
shingles. Somebody had horrible stress and ended up with severe shingles. And all the natural stuff that I was doing with her didn't work, and she ended up having to go. She was on acyclovir, but she had to take some gabapentin for a week to just, the pain was intolerable. So that was a total buildup of months of stress that she'd been under. So,
And the body holds on to that, right? We
oh yeah,
know the body does keep the score. And so that's why the work that I do is so ingrained in tapping into this body, making the connection, how to, deal with pain through our soma, through our body, with practices like meditation and mindfulness and breath work, things that your doctor likely isn't prescribing, but can be such an amazing companion. And you might find that you don't need as much medication, or you don't need certain medications at all. I'm grateful for that we have these medications. It's a great bridge, and sometimes it's necessary. Like we
oh,
need to stop the hemorrhage, or when the pain with shingles. Oh my God, I've had shingles. It's significant, and also once that pain level, that threshold is maybe a little bit decreased, what else can we do? And that has to do with coming back into this body of ours.
100%. So how do women reach you?
Yeah. So my website, drkeirabarr.com, it's going to get an overhaul soon, but that's a good place to find me. And on Instagram at Dr. Keira Barr. And I'm excited soon. I'll be launching, my podcast, Skinny Dipping Prescription podcast, really shares some tips and information as well. And I've had some great guests that share information about fasting and lifestyle and navigating this season of life that we're in. So that's another great resource.
That's wonderful. It's always such a pleasure. It's wonderful to hang out with you. And it's just, we're so simpatico. She and I are two peas in a pod, ladies. So her expertise is the skin, but she's branched out and using skin as a metaphor to life. And really, that's really what it's all about. So thank you so much for being here, for your time. And Ladies, this is Keira Lourie signing off for now, and there'll be more later, and have a wonderful, vibrant day. And please reach out to me here, or if you need more one-on-one time, you can email me at support@thepathofbreastcancer.com. That's all for now, and there'll be more later.
Bye.